I'm Tiffany. I am a physician assistant and I like to talk about health and wellness on my channel. So you may have been hearing in the headlines that there is a simple blood test for Alzheimer's disease. Let's unpack what that means. So it's true, in May of 2025, the FDA did approve a blood test to look for amyloid plaques. Now, this is actually considered the biological hallmark for Alzheimer's disease. And this test is for people 55 and older who already have memory loss. So it's important to note this test is not for healthy people. It is for people who are already showing signs of cognitive impairment. So just a few days ago, at the end of July, the Alzheimer's Association released some new guidelines for clinicians on how to appropriately use these blood-based biomarker tests. And here's what they recommend. So these tests are about 90% sensitive and about 75% specific. So here's what that means in plain English. So a negative result can reliably rule out Alzheimer's, but a positive result needs to be followed up with further testing. When a test has a high sensitivity, it means that we're going to miss very few cases with this test. Because it's highly specific for Alzheimer's, it also means we're also going to have very few false positives, which is also good. But one of the more important takeaways from the guidelines that they issued was that someone should have a comprehensive clinical evaluation from a specialist before one of these blood-based tests are run. So let's talk about, as an average person, what this means to you. So myth number one, you can get a simple test and tell if you have Alzheimer's. That's false. This test is not meant to be a screening tool for healthy people without symptoms. This test is actually meant to support, but not replace, clinical testing like memory tests and other images. Myth number two, a positive blood test means that you definitely have Alzheimer's. Also false. So even though this test is pretty highly sensitive and specific, it is gonna miss some cases. And all positive tests have to be followed up with confirmation testing, either by PET scan or testing of the cerebral spinal fluid. But the creation of this blood test is important because this could allow us as clinicians to make earlier diagnosis for people and get them treatment sooner. So if you or somebody that you love is having memory concerns, the very first thing you need to do is schedule an appointment with your primary care provider, talk to them, look at getting a referral to a specialist to get a comprehensive evaluation clinically. Then, if they think it's necessary, they will order the appropriate blood testing for you. If the test is positive, they will go on to do additional testing like a PET scan or a test of your cerebral spinal fluid. So if you're hearing this news and you think that getting tested for Alzheimer's is just as simple as going to the doctor's office and getting your blood drawn, just know there's more to it than that. And also keep in mind that Alzheimer's is just one form of dementia. We also have vascular dementia and other forms of the dementia that this blood test cannot determine. So if you like all things health and wellness, then please follow me for more info.